My speech today is on obsessive compulsive disorder, commonly known as OCD. The reason why I chose this speech is because a lot of people have heard of OCD, but not very many people know that much about it. If you've ever watched the TV show Big Bang Theory, Sheldon Cooper, one of the characters, has many signs of OCD. He goes from washing his hands consecutively to knocking on the door 3 times, his spot on the sofa, and severe organization. They even did an episode where his girlfriend Amy tried to help him with some closure issues that he has. So she played a game with him, but she didn't let him finish it. And she made him set up dominoes, but she wouldn't let him. Once he got it set up, she'd go mess it up, and he couldn't finish it. And that was just, she was trying to make him understand that not everything in life has a conclusion. At the end of the episode, when she thought she made a breakthrough, he went back and redid everything that she wouldn't let him finish, and he finished it. Even though it was a funny episode, as I was watching it, it reminded me of how lately people take people with OCD. It is a very difficult to function in society, and without proper treatment, some people can't even leave their homes. I hope by the time I'm done with my presentation, many of you will have a better idea of what OCD is and what the signs and treatments are available for this disorder. So now let me start with the question that you can think about. Do you know what the definition of OCD is? From iocdf.org, the definition of obsessions is thoughts, images, and impulses that occur over and over again without and feel outside of the person's control. Obsession is typically accompanied by an intense and uncomfortable feeling such as fear, disgust, doubt, and feeling that they have to have things just right. The last part is extremely important to keep in mind, as it in part determines whether or not someone has OCD, a physiological disorder, rather than an obsessive personality trait. Unfortunately, obsessing or being obsessed is commonly used terms in everyday language. The more casual uses of this word means that someone preoccupied with the topic or an idea or even a person. You can be obsessed with a new song and hear it on the radio, but you can still meet your friend for dinner or go to bed in a timely way and even get up and go to work on time in the morning, despite this obsession. The definitions of compulsion is the second part of OCD, and is a repetitive behavior or thoughts that people use with the intention of neutralizing, counteracting, or making obsessions go away. People with OCD realize that it's only a temporary solution, but without a better way to cope with it, they rely on the compulsion as a temporary escape. Compulsion can also include situations that trigger obsessions. Compulsions are timely consuming and get in the way of important activities. Similar to obsessions, not all repetitive behaviors or ritual are compulsions. You have to look at the function and the context of behavior. For example, bedtime routines, religious practices, and learning a new skill all involve some level of repetitive and action and activity over and over again, but they're usually in a positive function of daily life. Behaviors depend on context. Similarly, you can have compulsive behaviors that wouldn't fall under OCD if you're just a stickler for details or have things neatly arranged. In case compulsive refers to personal traits or something about yourself that you actually prefer or like. In OCD, compulsive disorder is done with the intention of trying to escape or reduce anxiety or the presence of obsessions. So now that we know the definition for OCD, what causes this disorder, what are the symptoms? Examples of OCD signs and symptoms are fear of being contaminated by shaking hands or touching objects that others have touched. doubts that you've locked the door or turned off the stove, intense stress when objects aren't orderly and facing a certain way, images of hurting yourself or someone, thoughts about shouting obscenities and acting inappropriately. The examples of compulsion signs and symptoms are washing hands until skin becomes raw, counting in certain patterns, silently repeating a prayer, word, or phrase, or arranging your canned goods to face the same way. Symptoms usually begin gradually and tend to vary severely throughout your life. Symptoms generally worsen as you experience more stress. OCD is considered a lifelong disorder and can be very severe and time-consuming and become disabling. There are differences between the perfectionist and having OCD. Perhaps you keep your floors in your house so clean that you can eat off them, or you like your knickknacks just arranged just so. It doesn't necessarily mean you have OCD. If you are obsessed, obsessions and compulsions are affecting your quality of life, see a doctor or a mental health care provider. People with OCD may be ashamed and embarrassed about their condition, but treatments can help. Some of the risk factors may cause the developing and triggering obsessive compulsive disorder are your family history and stressful life events. So now that we know more about the symptoms and the risks, what about treatment? Before you get treatment, you should see a doctor so they can run some tests like physical exam, lab tests, and psychological evaluations. Once you've done that, there are many forms of treatment. The two main treatments for OCD are psychotherapy and medication. Often treatment is the most effective used in a combination. Therapy is one of the treatments, and the type of therapy is called exposure and responsive prevention. It is the most effective treatment. This treatment involves gradually exposing you to fear objects or obsessions such as dirt and having you learn healthy ways to cope with your anxiety. Exposure therapy takes effort and practice, but you may enjoy a better quality of life once you've learned to manage your obsessions and your compulsions. There are also medications that you can take to help. Certainly, psychiatric medications can control obsession and compulsion disorder of OCD. Most commonly are antidepressants like Prozac, Paxil, and Zoloft. I hope everyone has learned a little bit more about OCD. It's a very serious disorder, so if you or someone you know has any signs of this disorder, at least you know what to look for and what you need to do to get it checked out. I hope you've all learned as much as I have today. Thank you all for listening.